Hi there, Professor Warsi. Today is the second lesson in Conversation English. We will learn how to speak to a doctor when we're sick, okay? How to call the doctor's office and make an appointment. And we'll talk naturally about health issues in American English, how patients speak to a doctor, okay? So, these are the goals for today's lesson. And if you stay with me until the end, you will learn how to call a doctor's office, make an appointment, and then when you see the doctor, how to describe your symptoms. Oh, my back hurts. And doctors will ask you lots of questions about your health, and you should be able to understand the questions and reply to the doctor using polite language. And we will also practice pronunciation. Okay? Let's begin. So these are some of the key vocabulary words, common words that you will hear when you go to a doctor's office: appointment, checkup, prescription, symptom, fever, sore throat, cough, stomach, dizzy, and headache. All right. So let's do an exercise. Match the word with its meaning. So there are 5 words: prescription, checkup, fever, dizzy, and sore throat. Okay, so match each word with its meaning. Pause the video now. Practice. It would be great if you could just practice speaking, right? Pronounce these words, or even pronounce the meanings also, all the words in the right column. Let's do this exercise, and I will show you the answers when you're done. These are the answers. Prescription is a note from the doctor for medicine. Checkup is a regular health exam. When you go and see your doctor, they do a checkup. Fever is when your body temperature is really high, like, I think I have a fever. Dizzy is when you feel lightheaded, right? Your head sort of just spins a little bit. You say, I don't know, I'm feeling very lightheaded today. And sore throat is when you have pain in your throat. Sometimes people, get the flu or catch a cold, and they feel a little bit of pain in their throat. All right? Okay. So some common expressions to use when a patient goes to a doctor is calling the doctor's office. Hi, I'd like to make an appointment with Dr. Lee. Is there an opening this week? When can I come in and see the doctor? Can I see the doctor tomorrow morning or tomorrow evening? When you get to the doctor's office, when you arrive, you say to the office assistant, you say, I have a 2 p.m. appointment with Dr. Lee. Hi, I'm here for my checkup. Can I fill out the form here? Now, here's a pronunciation tip for you. In American English, I would like to sounds more like I'd like to. So rather than saying I would like to, which is going to sound very unnatural, not very smooth and natural, try to pronounce it. I'd like to talk to Dr. Lee. Practice it very slowly. I'd like to make an appointment. Okay. When you have a stomach ache or a headache or your back hurts, you have a fever, you're sneezing, you're coughing, how do you explain to the doctor what the issue is? Dr. Lee, I don't feel well. I've been coughing a lot. I have a sore throat and a fever. My stomach hurts. Dr. Lee, when I stand up, I feel dizzy. Okay? Now remember, native speakers often connect words, right? I have a sore throat. They say, not have a. I have a sore throat. I have a sore throat. So practice speaking with me, and you will see that your pronunciation will also improve as a result. So let's try this out, okay? I'm giving you a sample dialogue at the reception. Just imagine that you are at the reception. You go, you walk into the doctor's office, there's a receptionist there, and you say, she says to you, "Good morning, how can I help you?" And you say, "Hi, I'd like to see Dr. Lee. Do you have an appointment?" "Yes, at 10 o'clock. "Great. Please sign in and take a seat." Now, in American culture, it's important to be polite, but not talk too much. Americans value time. They say time is money. So smile, make eye contact, and say thank you, and take a seat, and wait for the receptionist to call you. A second dialogue with the doctor. So now you go and see the doctor. Your name is called, and you say, okay, you go, you see the doctor, you say, "Good morning," and then the doctor will say to you, "So, what seems to be the problem?" And you say, "I have had a bad cough for 3 days." The doctor asks, "Do you have a fever?" "Yes, a little." "Any sore throat or chest pain?" Just a sore throat." "Okay, I'll prescribe some medicine." "Thank you, doctor." So pronunciation practice. I will say these sentences, and I need you to repeat after me and pronounce the words carefully. "I've had a bad cough for 3 days. Not I have had, but I've had a bad cough for 3 days. "I have a sore throat. "I feel dizzy. "Can I make an appointment?" Okay? So don't pause between "of" and "had," right? You have to link these words smoothly. Don't pause between "I've had" or "I feel." Just say "I feel," "I feel," smoothly. Don't pause. "I've had," "I feel." Okay? I think it's a good idea for you to record when you speak, so then you can compare it to native speakers. It's a really good idea to improve your pronunciation of English. Okay, so try these short conversations aloud. In fact, I can be A and you can be B. So making an appointment. I am the receptionist. You call the number. The phone rings. I pick up the phone and say, "Hello, Dr. Lee's office. How can I help you?" And we say, "Hi, I would like to make an appointment for tomorrow morning." And I will say, "What's wrong with you?" "I've been coughing a lot and I have a sore throat." Then you see the doctor. The doctor prescribes you some medication, and you go to the pharmacy, right, in your area, and you go to the pharmacy and you ask the pharmacist, you say, "I need to pick up a prescription for Alex Chen." "Sure. Please wait a moment." Okay? So you can role play this by yourself to practice speaking American English in a natural context. Do you remember the dialogue that we just had? What is the patient's main symptom? Did the patient have a fever, a cough, or a headache? What was it? Do you remember? It was a cough. The patient kept saying, "Yeah, I've had a cough. I have a sore throat. My chest hurts. I have a little chest pain." Yeah? Okay. So let's do a little grammar here. I think it's important. A present perfect for symptoms. I have had. Meaning not just now, not just today, but you've had this headache since Monday, for 3 days, or for a week. She's felt tired all week for 7 days. Okay? So complete these sentences before we move on. There are 2 sentences, I, and there's a blank. So fill in the blank with the right form of the verb. Pause the video. It will take you 2 seconds to complete this exercise. Okay, so the first one is, I have had a sore throat for 2 days. But try to link have and had, right? So rather than saying, I have had a sore throat for 2 days, say, I've had a sore throat for 2 days. I've had a sore throat for 2 days. She has felt dizzy since yesterday. So far, so good. How are you doing? I think you're doing well. You're getting all of the answers correct, right? Let's try this quiz. Fill in the blank. Choose either A or B for each sentence. I blank see the doctor today. After that, do number 2 and then 3. So the first one is, I want to see the doctor today. So that answer is A. Number 2. What does I've had a cough for 3 days mean? What does it mean? Is it A or B? I've had a cough for 3 days means the cough began 3 days ago and continues. Number 3. The doctor gives you a paper for medicine. What is the paper called? It's a what? It's a prescription, correct? You must remember that. Okay, so let's review before we wrap up this lesson. You learned how to make an appointment, how to explain to the doctor the symptoms, use I have or I've had for health problems, speak naturally, and always thank the doctor or nurse, right, who checks your blood pressure. Okay, very good. So it's your turn now. Write or record your own short dialogue with these steps. Make an appointment, describe one symptom you have, and just monitor your own pronunciation. Listen to your own pronunciation to make sure that you are pronouncing the words correctly, and post it in the comments, and I will give you some feedback. Okay? You may want to retake this lesson to learn how to describe symptoms, how to make a request to see the doctor, how to make an appointment, and so on and so forth. All right? Very good. Thank you for watching, learning with me. I think you're doing great. There will be more lessons coming up on conversational English. So stay tuned, and I will see you in the next video. Bye-bye.